So probably you picked up on the judgmental tone of that nurse where, you wouldn't be needing any kind of pain reliever if you had just gone to your Lamaze training. And that's not really true. Even with Lamaze training, you might need some pain relief. Women who go in with the expectation that they should be able to have a baby without any pain relief and that somehow they are a failure if they need pain relief, that's not healthy and happy. That's not going to produce, good deliveries for the mom. This is going to make it very traumatic for mom. And so being open-minded and being willing to accept help if necessary is super important. And having the medical professionals not act judgmental is super important. Now, another choice, I guess, or decision that has to be made sometimes is whether to have a cesarean section delivery for the birth. Now, there are some times when it is not a choice. You have got to have a C-section because mom's life might be in danger or baby's life might be in danger. So transverse breech is where the baby's sideways. That baby, if it won't turn and stay turned down, is not going to be delivered in that position. Breech presentation where it's butt first or feet first, I already explained why that needs to be done through C-section. Placenta abruptio is where the placenta has separated from the uterine lining before the baby has been delivered. And so that means that the baby is now deprived of oxygen and nutrition and needs to get out of there right now because it can suffocate. And then we've got placenta previa in the bottom right, and that's where the placenta is closer to the cervical opening than the baby is. And so the placenta is probably going to be delivered before the baby. And so this, again, would deprive the baby of nutrition and oxygen. And so the baby needs to be taken C-section. So in all four of these cases, there is no question that these babies need to be delivered through C-section. Where we get into some difficulty is when a person is having a C-section in a non-emergency situation, what we call an elective C-section. Here we have, so you're due on the 17th, the doctor says, and mom says, I'm all booked that week. Let's go C-section on the 4th. How does 1 p.m. sound? Like they're trying to fit the delivery into the rest of their lives, and so this would be more convenient. That's the kind of thing that we're concerned about where, choosing to have a cesarean section, which is a major surgery that cuts through the abdominal wall, the uterine wall, removes the baby, sews the uterine wall up through a series of different layers. There's 3 muscle layers in the uterine wall, then sews up the abdominal wall. You've got a really long recovery, a lot of pain, risk of bleeding out, all sorts risks of infection, all sorts of things that you're doing because it's convenient. That's where we're concerned. When I first started teaching human sexuality in 1992, we were all aghast that it was like 22% of deliveries were C-section. And a lot of those we were attributing to fears about, malpractice lawsuits. And so it was like, we have to do everything we can. And so we'll deliver a baby that maybe even isn't even remotely viable anyway, but we do it via C-section so that the parents won't later think it was medical malpractice not to have done it. So with that kind of pressure, there was like a slight reduction there in the late 90s where people weren't opting for C-sections as often as they had been in the early 90s. And then it has been steadily climbing. And in fact, the number is even higher. It's about a third of deliveries are C-section these days. And that's very concerning because it can't possibly be that all these moms are having these really super high risk deliveries. There's got to be some degree of people choosing for C-sections. And there is with everything having to do with motherhood, there are these 2 camps, and the 2 sides think the other side is terrible. So you've got planned cesareans may increase health risks in children, right? And Naturally Savvy is going to tell you all the ways in which choosing to have a C-section is going to actually be harmful to your baby. And then we have the moms who argue that an elective C-section is fine. And, they've got their side and they're going to say all their reasons for why it's fine to make that decision. And it's just one more decision that mothers have to make. I'm not going to get into the middle of the argument per se. I'm just going to say that there are increased risks when a baby is delivered via C-section versus a vaginal delivery. Number one is that women who have experienced C-sections have more pain postpartum than moms who deliver vaginally. The vagina is designed to stretch. The cervix is doing what it's supposed to do, and everything's designed to work like that. And it tends to return back to its normal state pretty quickly. So pain tends to be lower in women who have had C-sections. They absolutely don't have an incision on their abdomen and in their uterus. Another way that pain is lower in a woman who has given birth vaginally is that when their baby latches on for nursing, if the mom is doing that, the woman who's had a C-section with those scar tissues, it's more painful when the uterus contracts like it normally does to reduce back to its normal size, creating significant pain. Whereas for vaginal birth, it's painful. The uterus is contracting downwards, but it's not as distinctly painful. C-sections increase your risk of blood clots, infection. Adhesions are where the surgical scar is attaching to other things. And the biggest risk is that the uterine scar will attach to the abdominal scar. And as the uterus retracts back down to its regular size, it's now attached to the abdominal wall and it has to tear loose, and that really hurts. And then of course, anytime the C-section is being conducted under general anesthesia, you have, risks associated with that, where mom might aspirate and choke, or a variety of other things that I don't even want to say, because I don't know about you, but whenever I think about general anesthesia, I'm already scared enough. So I don't want to say anything, but there are risks. I think that's just the conclusion. Now, postpartum, there are lots of changes, right? Life is never going to be the same once a person has had a baby, right? A couple has a baby in the family. So some factors that limit the resumption of sexual activities for 6 weeks after giving birth is the existence of an episiotomy scar. So our teal colored line here is showing the rates of episiotomies. 1997 is on the left, 2006 is on the right. It's becoming less and less common to do episiotomies during childbirth. Episiotomies are where a type of scissors, a very large type of scissors, is used to cut the perineum, which is the skin between the vaginal opening and the anus. And that allows more room for the baby's head to pass through. And the premise with an episiotomy is that if you do a surgical incision, it will be less likely to create a jagged scar that would be harder to sew back up. And so the scar would be less painful, they thought, if it was done by the scissors rather than by the baby's head tearing the perineum. Nowadays, one of the reasons why episiotomies are less likely to be performed is that they've developed a perineal massage technique that helps to stretch the perineum prior to the baby's head arriving. So usually what they do is put I'm blanking on the brand name, KY jelly. There we go. KY jelly into the vagina during delivery. And then they massage the perineum, pulling it and stretching it so that it's kind of loosened up and ready when the baby's head arrives, and it's less likely to tear. The shock of the baby's head pressing on it sometimes causes the muscles around the perineum to kind of tighten up and make it more likely to tear. So with the addition of perineal massage, there's less need for episiotomy. But if you have a really big baby's head or big baby's shoulder, it might tear the perineum, and people are like, oh no, tear, that's got to be bad. It's got to be painful. Well, it turns out that the tear doesn't hurt any more than the scissors hurt. And come to find out, the more jagged scar tends to heal more smoothly and with less pain than the surgical scar. So that's another reason why episiotomies are less common. Nevertheless, among those who have had episiotomies, there is a healing wound. And that's one factor that, you don't want to have sex during the time that you've got a healing wound on the vaginal opening. That's for sure. So episiotomy scars. Another factor that can limit resumption of sexual activities is C-section scars. Missionary position, you're going to have somebody else's weight right on the C-section scar. Rear entry position, you're going to have potentially pressure through the uterus onto that scar, right? It's pain. Both of these examples would be pain as limiting factors, right? Another limiting factor is that after birth, the endometrial layer needs to shed in a flow that's called lochia. It contains all the lots of tissue and other things that are being shed after pregnancy. And that tends to last 2 to 6 weeks, depending on the person. But during that blood flow, you absolutely would not want to resume sexual activities because it's a really good sign that the uterus has not healed yet. about 4 to 6 weeks, although I've seen a lot of breastfeeding moms who the lochia will be more like 3 weeks than like 6 weeks. Like breastfeeding is really beneficial for shortening the duration of lochia. Let's talk a little bit about breastfeeding in our newborns. Breastfeeding, we get again another mommy war situation where we talk about it being best for the baby and somehow this judgmental if you feed your baby something else. Since this is not lifespan development, which I also teach, and I talk about the benefits of breast milk for babies, I thought it would be good for this class. I'm going to focus on the benefits to mom for breastfeeding and why it might be to her advantage to breastfeed if she can. One of the biggest benefits of breastfeeding is that it contracts the uterus. When the baby latches on, it causes a release of a hormone called oxytocin. And oxytocin causes constriction of all of your soft muscles. And so soft muscles would include the uterus. It also includes the intestines. And so breastfeeding moms are rarely constipated because their baby latching on is actually helping to move their bowels, which is actually really an important thing. That might sound like, what are you talking about this for in the middle of a human sexuality class? But I mean, it's a really important thing for mom's health. So the boost of oxytocin moves those smooth muscles like the uterus, and it does shorten lochia, shortens bleeding. It boosts cortisol levels. And this is really important because during pregnancy, mom has been receiving a big boost of cortisol from the placenta. Cortisol is a hormone that helps us to combat stress. And so as a mom is pregnant, her body is under a bunch of stress. And of course, her life is changing and things are happening that are stressful as well. But while she's pregnant, she's like better equipped to cope with that stress than she would have been even before she got pregnant, because there's all this cortisol coming through the placenta. After giving birth, the placenta leaves, and about 3 days later, the brain starts to recognize, I don't have any cortisol. Like I forgot how to make my own because I was getting this free cortisol somehow. And so it takes a few days for the cortisol to really start manufacturing itself and getting on board. So about 3 days after delivery, moms will oftentimes experience what we call postpartum blues, where they literally are teary. Everything is overwhelming. They don't even know where they left their baby's diapers. I'm so confused. I'm all upset. Like, why can't we all just get along? I'm just like, everything is too much. In breastfeeding moms, they will start producing cortisol faster, again, because of that baby latching on and causing release of different hormones. And so that baby blues will typically start to wane faster in a breastfeeding mom than in a non-breastfeeding mom. If the baby blues go on too long, they can convert over into postpartum depression. And it's much less likely that a breastfeeding mom will experience postpartum depression than a mom who is not breastfeeding. It's not a guarantee. You cannot guarantee or protect completely against postpartum depression by breastfeeding. I'm not trying to argue that. I'm just saying it's lower in women who breastfeed. So we got the boost of oxytocin, and it's having the effect on the smooth muscles, but it's also having an effect on mom's brain and making her feel a lot more cuddly towards her baby. If you've ever seen a baby, the video of a baby being born, and you as a witness are like, oh my gosh, that baby is like so gross looking. And then mom like wants to cuddle it and hug it as if it's not covered in like some gross stuff, white stuff and some little bit of blood, and mom's like, oh my God, it's beautiful. And you're like, its head is pointy. What are you talking about? The oxytocin that moms experience really help them to bond with their babies. And so by breastfeeding, she gets this burst of oxytocin that makes her look down at this baby and say, it's so adorable. I just want to take care of it. I just want to, its crying doesn't even really bother me as much as it would a person who's not breastfeeding and not getting this boost of oxytocin. It also boosts serotonin, which for one thing will help to avoid postpartum depression, but also just makes mom feel more at peace with the world. Like everything is better when you're under the influence of serotonin. So all sorts of benefits. Now I'm going to be honest. It is not perfect. It's not the easiest thing in the world to do. One big deficit of breastfeeding is that for the entire time that a mom is nursing, her estrogen levels will look more similar to a postmenopausal woman than to a woman who is in her reproductive years. And that means she's going to have vaginal dryness and other, skin dryness and other kinds of things, higher risk of heart disease during the time that she's breastfeeding, things like that, in part because of this low estrogen. Now, one of the great things about the boost of oxytocin is that your heart is a smooth muscle. And so a lot of times breastfeeding will actually protect against what normally would happen in the face of lowered estrogen. So it's kind of a cycle. It's kind of a bouncing off, but definitely the vaginal dryness is a problem that a lot of postpartum women just, while they're nursing, they're like, why am I having so much trouble with lubrication? And that's why. Mastitis is very common. I recently read that 80% of breastfeeding women experience mastitis. That seems a little inflated to me, but mastitis is where you get swollen milk glands and they'll sometimes get clogged and sometimes get infected. And so this is something that happens in, I'm going to say a large number. I'm not completely convinced it's 80%, but I'm going to say a large number of women experience to some degree mastitis or cracked nipples or other painful things that make it very difficult to breastfeed. Here in the US, there are some cultural taboos. They are shifting. Back in the 90s, when I first started teaching this class, there was a lot of conversation about how disgusting it was for women to breastfeed their babies in public, or, I don't want to be seeing that while I'm at the mall, or these kinds of things. A lot of that has been shifting, but we still have some cultural taboos. We really have this sort of expectation that breasts are for sexual attractiveness and that's it, and that babies shouldn't be nursing like that. And that's a cultural thing. And sometimes that's hard to buck. If you need to go shopping and you've got your newborn and they need to eat, sometimes it's very complicated for women to decide whether they want to breastfeed or not. It's also time consuming. If a mom needs to return back to work after 6 weeks of maternity leave, she's going to have to pump in order to maintain her milk supply. And with a newborn, you're going to be nursing like every hour and a half for maybe 45 minutes with this new baby who doesn't really know how to latch on. And you're like, wait, it seems like all I'm doing is nursing. I nurse for 45 minutes. I maybe get a 45-minute break and then we're back at it. Like, this is a lot. The good news is as they age, they nurse more efficiently, and so they can do it for less time. But it's still, for the entire time that a mom is nursing, she's got to be available to that baby all the time and willing to nurse all the time. And that can be really super time consuming. I'll finish this segment by saying if a mom decides to nurse, I really strongly recommend pumping milk throughout that time so that there's always a supply in case something happens and mom needs to be away from that baby. What if she gets sick and needs to be in the hospital, or who knows what factors could go into why a mom would have to be separated from her baby. It's already stressful enough for the baby. It's already stressful enough for mom. Knowing that the baby has some breast milk available is a huge advantage. And one of the best ways to make sure that the baby will always take a bottle is to give dad an opportunity to feed the baby with a bottle all the time, even though mom's breastfeeding. So that's my little, experience-based tip on how to maintain breastfeeding efficiently. All right, let's go ahead and stop here and we'll come back and talk about, okay, well, when could you get pregnant again?